Hello, my name is Bill Berquist. I'm a member of the Global Psychology Task Force that is focusing on the psychological ramifications for the virus. And I'm pleased to introduce my colleague, Dr. Suzanne Brennan Nathan, who tested positive, now in recovery, to share something about her own insights about being impacted by the virus and what it means, especially as a psychologist who has insights about this process. So Suzanne, tell us a bit about the experience.
Well, my experience is that the virus felt very far away for a long time. And I'm someone who's traveled all over the world and been in a lot of different countries, and I'm not particularly germ phobic or worried about catching diseases. I've gone on a lot of adventures, and I think I had a little bit of bravado about the whole thing. I don't think, because it hadn't really hit the United States, even though we were hearing about it, I didn't really feel very concerned about getting it. I was conscious, I was being careful, I was using hand sanitizer and washing my hands all the time and using all the precautions, but I didn't really feel that I was gonna get sick. I wasn't really worried about it, and I think I was a bit cavalier about the whole thing, to be honest, even though I took precautions. And I went to New York City for a week-long conference in New York, and when I went to New York, the virus, maybe a few people had it in New York, and nobody was really concerned about it. We all were sort of aware. I mean, there was a lot of medical people at the conference. We were all aware that it was coming, but everyone, the conference didn't get canceled. We used hand sanitizer and washed our hands all the time. And I think all of us were a bit naive about how virulent the virus is. And I must have contracted it sometime during the conference. It was at a hotel where there was a lot of people from all over the place, all over the world coming to the hotel. And who knows where it came from, but a lot of people, after a few days after the conference, many of us started getting sick, and I was one of the people who got sick very early on, which at the time felt incredibly unlucky, like, why me? Why did I have to get this? But in retrospect, I think it was lucky in some ways, because I mean, it's lucky, number one, that I had good medical care and that I lived. But what was also lucky is that now, at least in Boston where I live, the hospitals are really overwhelmed. And I have, I work with several people who are physicians or nurses at various hospitals in Boston, and they're just very overwhelmed. It's really, there's not enough ventilators, there's not enough beds. You don't know what's going to happen when you get the virus. It's pretty overwhelming for people, and floors are, that used to be, like, for example, at the Brigham, what used to be the cardiac floor is now the COVID-19 floor. And not only am I observing that it's really difficult for staff who are just overwhelmed with the amount of patients and the amount of severity of the patients, of their sickness, but also people, like, for example, who are in the middle of chemotherapy, their chemotherapy is being stopped. There's just a lot of things happening that are really difficult, both for the providers and obviously for the patients. When I got sick, it was pretty frightening, because I have asthma, I'm, in the high risk population. I was frightened about what was going to happen, but in all honesty, I was so sick, I didn't have time to be that frightened, because it was so virulent, the virus. It felt like having a very terrible case of the flu. And how it manifested for me was that I had a fever of 104 at times. It would range between 100 and 104, and it lasted for a really long time. I had the fever for over a week, and I started getting frightened because I was so weak and tired and exhausted and barely able to lift my head off the pillow, although my breathing was never affected. So I didn't, they almost put me in the hospital near the end of the virus, but because my breathing was okay, they decided not to, and instead my doctor decided they were using the anti-malarial medication as sort of a test drug, and so I sort of was part of a test, and actually for me, and maybe it was at the end of my virus, I'm not sure. It's not clear. There's not enough science yet to know how effective the drug is, but my experience was as soon as I got the anti-malarial medication, my fever immediately went down and to normal, and within a few days I could tell I was still sick for another week, but I could tell I was getting better. And at that point, that second week, I got pretty depressed at one point, because especially near the end when I still felt sick and it didn't seem like I was getting any better, I felt really depressed. Some of it's that my son, my kids are in different, were in different cities. My family lives on the West Coast. I was thank goodness I had my husband who nursed me through the experience and then got sick himself, although he never got it as badly as me. But, I felt very distant from people and separate and alone and isolated from my friends. And, I've had a lot of losses in my life over the last few years, lots of, significant people dying. And I sort of had this depression, like, is this all there is? Like, you just get sick and one day, and some bizarre virus gets you and you just get sick and you're isolated and you can't see people. And I felt sort of like, what's the point of all of this? I felt very depressed.
I was thinking, there's, our colleague Sharon Ma from China. She says, the virus knows humans very well. The virus has been studying humans for many, many years. And the virus knows where we're most vulnerable, which is in our relationships with other people.
Yes.
So you're talking about what it feels like to be very sick, but then to have to remain distant from other people. And so it's not just a case of being anxious about your own experience, but the depression that comes from truly feeling estranged and alone.
And my parents are in their late 80s and early 90s, my stepfather and my mother, and I was worried about them, and there's nothing I can do, and it's this very helpless feeling of being in quarantine and isolated and not being able to see any people that are, other than my husband, who were really important to me. That was it. And not knowing how they are, except from phone calls and texts and things. It was a very bizarre experience, and I got quite depressed initially. Of course, when I started to feel better, that helped. Some of my, once I knew I could at least go to the grocery store and that I was out of quarantine, just even with social distancing, seeing other human beings in the grocery store was a huge relief. That really lifted my spirits, and we had a couple beautiful days where I could sit in the sun and appreciate, I had so much gratitude for feeling healthy, and gratitude for the sun, and gratitude to be outside, and some of the positives are there's no traffic, and it's very nice and peaceful and quiet, and there's not as much stress, and I have time to go for walks, which when I'm working, I don't have nearly as much time to take care of myself. And so, I'm eating healthier, like there's like, it's just so many things. There are a lot of positives for me as a provider, you know, not having to commute into work every day, and having a little bit of extra time to be able to take care of myself a little bit better. I mean, some of why I think I got sick was I think a lot of providers get very run down because we work so many long hours, and we're taking care of everybody else and not as focused on taking care of ourselves. So,
Well, let me ask this as we bring this to a close. What are several of the things that you have learned about yourself, but particularly about how to deal with this massive intrusion in your life of the virus? What are some things that you might say to other people that you gained from this experience?
well, I think one thing I've really gained and that I'm trying to pass along to my own patients is to make a plan every day. I mean, it's sort of almost like being under house arrest in some ways, although not quite that bad because we can go for walks and we can go to the grocery store. But to follow a self-care plan, to make sure you walk every day, even although it's really important to observe social distancing, or do extra. There's apps that have yoga. There's things that you can do inside the house, to keep yourself fit. That's really important. And then it's really important to be connected with people, even though, Zoom and FaceTime and texting aren't the same as live face-to-face contact. It's really, in a way, one of the things I've learned is what a gift some of that technology can be in a time like this. Like, I can't imagine what it would be like if I couldn't see people's faces, to be able, like tonight I'm having a virtual 60th birthday party for my brother with all my siblings. We're going to get all on Zoom together and celebrate his birthday. That wouldn't have been possible years ago. So I'm always somewhat skeptical about technology, and how it, and some of my research for my dissertation was about how technology is sort of sometimes getting in the way of genuine human connection, which we need. But when you don't have the genuine connection, it's actually very important. And so I've learned to sort of have a little more appreciation for technology than I had before, about how useful it can be in this kind of situation.
So I was thinking the other way you can think about the virus is that in some ways it's almost benevolent, that it waited for humans to have the technology so that it is essentially teaching us that there are new ways of being together, that we can be close, and forcing us to be close around the technologies, which allows us then to be close to people who are not physically near us, that we can be close to people around the world. And so you could say that the virus was there also to teach us, because we haven't learned independent of the virus. I want to thank you for this. And we're going to be doing other interviews with you. But this is wonderful that you've provided some ideas about your own experience and about what you've learned and what you can convey, not just to your own clients and patients, but also to other people who are coming to this website.
There's one other really important piece, and in terms of self-care, and that's making a plan every day about what you're going to do, having some goals of things you can accomplish in your home. It's really important to have a focus and have goals and things, even if they're like cleaning your basement. It doesn't have to be writing the next War and Peace novel, but just having a plan every day about what you're going to do is really important.
Good. Well, thank you very much.
Is it turned off now?